This is your Houston chiropractor, Dr. Gregory Johnson. We have Michael in here with us this afternoon. This is Michael's first visit here at Advanced Chiropractic Relief, and he came in here as a result of having a severe hiatal hernia acid reflux condition that he's been treated medically for over 2 years. You've been to the hospital, what did you say, 10, 15 times in the last couple of years?
In the last 5 years, approximately 10 to 15 times for my condition.
And he's had ECGs done at the hospital, and they say his heart's fine. He's been to a cardiologist, had a workup, heart's fine. But he gets these palpitations in his heart, and he gets anxiety, which is fight or flight. That's very commonly associated with acid reflux and hiatal hernia. You've seen 2 gastroenterologists and several other MDs for this, right?
Correct. I wanted a second opinion after my endoscopy, and I got the same results.
Yeah, which said you got acid reflux, sliding hiatal hernia. You take these PPIs, which you did for a couple of years, and then that affected your kidneys adversely, and you started having high blood pressure as a result of that, correct?
Correct.
So you decided to come and take the natural route and come here and see what this did for you.
Yes, sir.
From watching our videos. So he's volunteering to do this video. This is his very first visit to a chiropractor and his very first attempt at doing something natural for his acid reflux hiatal hernia. So I wanted to show you how we do the evaluation for that. I've already done his orthopedic neurological test, but I'm going to do a few of the highlights just to show you. Let's have you close your eyes and bend your head forward and backwards for me there, Michael. And into neutral, yep. Now see, his head's way forward on the Z-axis here. His ear's dropping way out here over his clavicle. His head's also translated to the left of center, and his body's tilting off to the left. You see that in the mirror, Michael? And then the pelvis has shifted way to the right of center. He's got a lot more room over here on the left side than he does the right side here. Less room here, more room over here.
Yeah, my right hand's almost in my pocket.
Yeah, see how this is over your pelvis, this one's not. So he's got a curvature in his thoracolumbar spine, which is right where the diaphragm attaches to the lower rib cage here. So I'm going to have you lay on your back here for a second. We're going to show them how much lower your rib cage is on that right side. One of the first things I do when evaluating a hiatal hernia acid reflux patient is I evaluate the alignment of their rib cage. And I'm on the bottom of his rib cage here, and you can see his right one is 1 inch lower than the left one here. And then when I put any pressure at all right here under his sternum on his fundus of his stomach, that's really tender, isn't it? Yeah. And then I went down here to his ileocecal valve. Well, that's just swollen and tender as can be right there. Yeah. Okay. So, let's go ahead and turn back on your stomach now for a second. Now, as I was talking about in my video yesterday, a good chiropractor can tell you where you're subluxated or misaligned and where you're having pain. His right leg is short by over ½ an inch. It gets longer when I bring it up, and that tightens up in your lower back, doesn't it?
Yes, sir.
See, his pelvis is misaligned right here in the right SI joint, which his pelvis was translated to the right. And that's tender right there. There, these are all tender, lumbar spine. And then right here in his thoracolumbar spine, right where that lower rib cage is also very tight and tender. And then that's real tender right there as well. And he's got some really tight shoulder muscles on him. He gets a lot of anxiety up here too from that autonomic nervous system fight or flight response. C6 and 7's out on the right there. And then C3's on the left there, and he's got an atlas on the right there where he gets some suboccipital headaches. Did I miss any, Michael?
Nope.
I'm going to have you lift your right leg up straight. Now see, he's got a hard time doing that. Let's do the same thing on the left side. See, he can go higher over here, so he's got a sacral deviation over here on this right side. That tells me that his sacrum is posteriorly rotated over here, and that's why he can't lift his right leg up as high when he locks his leg straight there. That felt restricted too, didn't it? So, we've ascertained that he is in fact a chiropractic candidate. So I'm going to begin adjusting him by adjusting his sacroiliac joints first. I'm going to adjust his right SI first. PIIN, which is posterior interior internal rotation. And now I'm going to adjust his right sacrum, which is where that sacrum has rotated posteriorly, right there. Now I'm going to adjust the sacrum right in the center, straight superior to inferior, the left SI joint. Now I'm going to go back to this right one again and adjust the internal rotation out of that. Now I'm going to drop straight down on L5. These will be a little sore at first, Michael. They'll feel a lot better when they quit hurting. There we go. I always saying that one. There we go. Just let this all relax here now. Yes, sir. Same here. Yeah, boy, we moved earth on that one. Crack addicts are gonna love you. Oh boy. You're gonna feel like a new man this evening, my friend. Yes, sir. Alright, we're gonna come down here and recheck his leg length now, and it's exactly even. Michael, tell me if this feels easier than the last one did.
Oh yeah, no pain.
Yep,
No lower back.
imagine that. Alright. So, he really was out of place right here in his thoracic spine where they meet the ribs here, and that's where most people that have acid reflux and hiatal hernia are subluxated, is in that thoracolumbar spine and mid-thoracic spine. Slide down this way just a little bit, please, sir. Okay, I'm going to feel your neck here now. And we're going to get right down here at C7. Slide down just a little bit more. There you go. That's it. Okay, good. Now let's turn you on your back, please, sir. Okay, just let your head relax there. I'm going to bring your head up and back. And we're going to bring your head slide down a little bit more. There you go. Up and back again. Good. Okay, now slide down about 1/2 inch. Yep, and put your arms straight out to the sides. I'm going to adjust your rib cage now along with your shoulders and your clavicles. Probably start feeling a lot calmer right after this adjustment too. Now see, his right rib cage was a little lower, so I'm going to be adjusting this not only laterally but superiorly as well. Okay, now put your hands right here and relax. Now this is probably the least comfortable part of this, but the most effective for pulling your tummy down. Just keep exhaling for me. I'm going to grab the fundus of your stomach, and I'm going to pull that stomach back down through the diaphragm. Keep exhaling. There you go. Okay, deep breath in. And exhale. Keep exhaling. There we go. Yeah, it's pretty tender in there, isn't it? Okay, one more time. And exhale again. They also told him he had H. pylori, which is a very common medical diagnosis that they give people, and he was on antibiotics for how long?
Oh, for about 6 months it kept.
And that didn't help at all, did it?
It's not going away. It's not going away.
Yeah, this is going to be a little sore, but it'll feel a lot better whenever I get done. That's not the same as it'll feel better when it quits hurting. There we go. Okay. And just relax your leg right here in my hand now. There you go. You should have felt that in your knee all the way up to your low back. Did you?
Yes, sir.
Okay. There we go. Same thing there?
Yeah.
Okay, let's sit you up and face towards Joseph there. How long have you been watching our videos before you made the decision to come in?
About 2-3 months.
2-3 months? And some of your friends advised you not to come in to see me, right?
Yes.
For what reason?
He said that,
I wasn't an MD.
no, that the chiropractic adjustments do more damage than good.
Oh, really? Well, how much experience do they have with it?
None.
There we go.
So I'll be the judge of that.
Yeah. Proof's in the pudding.
Yes, sir.
Okay, now comes the fun part.
I wanted to get a New Year ring dinger, but you were all booked up.
Yep. We're getting booked up through Super Bowl already. All these people coming in from out of state to the Super Bowl. So I'm glad we got you in. There we go. That's tight, I know. It's supposed to be. Just let your legs relax and bend. This is the way you should start sleeping, by the way. Have you been propping yourself up, by the way? Trying to sleep at a 45-degree angle?
Yeah.
Okay, you need to stop doing that right away. Sleep on your back flat with your legs elevated like this. For instance, if you were to go home and lay on the floor and put your feet up on the couch and lay flat there with no pillow under your head, that's exactly how you should sleep.
Okay.
And you might think you'll get more acid reflux, but you won't.
Okay.
This will help that. Okay, I'm gonna get this towel under your skull and under your chin. Keep your teeth together. Take a deep breath through your nose. Oh yeah. That's why we call it ring dinger. Felt that all the way down, didn't you? Kind of hard to talk right after that one. Did you feel that all the way down?
Yes, sir.
Okay. We're still not done yet. Take a relaxed breath. Okay, let me have you. Wiggle your right big toe. There we go. Now, tilt right a little. There you are. Boy, oh boy. You're gonna know you've been adjusted today. Is that different than anything you've ever experienced?
Yes, sir.
There we go. Okay, let's have you come over here in front of the mirror again. There we go. And when you get up, you always want to set up sideways, because when you sit straight up, that'll pull that stomach back up through
I
there.
see.
So we're going to have you face the mirror again. And I'm going to have you close your eyes and bend your head forward and backwards. Well, that's already better range of motion. Look in the mirror right now. See how straight you are comparatively?
Yeah.
Look at the difference.
My hands are even.
They're even.
Yep.
Pull this up and back. Standing up a lot straighter too. We're going to bring that head all the way back here. This is your homework, by the way. You can feel a little tap there. Another little tap there. Now relax again. And try that same thing again where you flex your head forward and backwards and tell me if this feels a little smoother to you than the previous one.
Oh, yeah.
Feel like I put a little WD-40 in there?
Yes, sir.
Look at your posture in the mirror right now comparatively.
That looks good.
Shoulders are squared off. You should feel like you can breathe easier right now.
I can feel my chest expand instead of
Yes.
my stomach.
Yep. Feel a little less pressure in your abdomen, your substernal area right now?
Feel a little lightheaded.
That's okay. That's okay. Does this feel a little less congested though?
Yes. My right hand doesn't feel like it's in my pocket anymore.
No, it's not. You're looking good. So how would you describe your very first experience here? And you can be truthful. We've never even met before and we haven't rehearsed any of this.
No, it's definitely a ring dinger. I feel different. I feel lighter, taller.
Yeah. And
I feel
does your
good.
stomach feel a little bit better right
Yes, it
now?
does.
You don't feel so
Absolutely.
much anxiety, I bet, either.
No, I feel relaxed and calm.
And praise the Lord.
Thank you. Yes.
Good deal.
Thank you, Dr.
Thank you
Johnson.
for sharing your experience with us, and we want to monitor your progress if that's okay with you.
Absolutely.
For those of you out there suffering with acid reflux and hiatal hernia, there is an alternative to PPIs with Nexium, Prilosec, and all those other PPI drugs, which can cause kidney disease and also dementia, by the way. And that's why you quit taking them, right?
Yes, sir.
Because you did get some kidney disease.
I did get kidney disease and high blood pressure.
As a
from that.
result
As a
of
result
that.
of that, yes.
So the PPIs over a long period of time do in fact have adverse side effects. Chiropractic is a drugless and surgery-less profession that deals with the underlying cause of the problem rather than treating the symptoms. And I think you're going to find this is going to work out really good for you.
Thank you very much, Dr.
All right,
Johnson.
look forward to working with you. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, home of the Super Bowl. We'll see y'all soon.